I'm excited with the opportunity to be in conversation with Joanna Maxwell this morning. And Joanna, I know that you're on the east coast of Australia. It's Friday night and it's 9 p.m. So I honour you because it's not easy to do this on a Friday night. But I do want to just say a few words about Joanna before we start. Joanna is just recently appointed Director of Human Rights Scrutiny at the Australian Human Rights Commission. From 2017 to 2021, Joanna was the Director of the Age Discrimination Team at the Human Rights Commission, and in between those two complex positions was the Director of Age Research at the Commission. It's interesting in her bio because Joanne refers to herself as a recovered lawyer with master's degree in international law and in older workers and social change. You will all want to go and get this book. Joanna is the author of Rethink Your Career in Your 40s, 50s, 60s, and you'll probably need to go into the 70s soon, Joanna. And it's about new retirement. So this is really important for us to be talking about, not only from an individual perspective, but also from a population-based perspective. So, Joanna, welcome. Thank you very much for being with us today at our IFA's Global Café.
Thank you very much for having me. Despite the fact that it is 9 p.m. on a Friday night, I can't think of anything I'd rather be doing just now.
Well, that's good. Now, Joanna, I've got a bit of a surprise question for you. So I'm going to give us a little bit of a context. So before we dip into the specific topic about changing perspectives, lessons from ageism awareness intervention, I want to take you back in your career to the time when you taught a year-long program for the Migrant Women's Micro Business Program in Sydney. And it really intrigued me. It really intrigued me as to these was your founding learnings, your founding career. You were there for quite a long time in that. You know, how did that time back in Sydney and working in this micro business program, how did it impact who you are today?
That's such an interesting and unexpected question, Jane. Thank you, I think. I really loved doing that. I often describe it as the most single satisfying block of work I've ever done. And I ran a year-long program over 5 years for migrant and refugee women in Sydney. And I think what we learned was that however different everybody was, we had in the first group, we had 25 people from 15 countries, 4 religions, aged from 28 to 62. But within about an hour, we were actually just a group of women sitting around a table, solving problems, sharing ideas, talking. And I think that informed so much of how I work today. Everything I do is much more collaborative, sharing, looking for the similarities than it might have been if I hadn't done that program, particularly because I'd been a corporate lawyer before that, and that's not actually a very caring, sharing kind of collaborative environment. So it was a really important bridging job for me.
It just sounds as though just in that, microcosm, one of the key skills that I think probably you intuitively have is listening. We so think that we're great communicators when we talk, when in fact that's not the case. So could you talk a little bit about this listening that you do, which has really been, I think, central to your career?
Yeah, you're right. I do think listening is critical. I'm a generalist, and I recovered from being a lawyer, and it took me a while to work out what else to do. So I tried a number of other careers, all of which have informed the work I do now. But one of them was journalism. And I think that's where I really learned to just sit and receive somebody's story. So I wasn't doing like news journalism or crisis journalism. I was interviewing people for long form articles about careers and creativity and things. And I think you learn so much more when you sort of shut up and listen to people than you do when you feel. I remember a Buddhist story I've always loved. I'm a bit philosophically a bit inclined towards Buddhism, about a really famous guy who was, rich and successful and wanted to find nirvana and climbed mountains to find this particular monk and whatever. And the story goes on and on and on. And in about chapter 4, he finds the monk and sits down and starts telling the monk the story of his life, and then says, so what can you do for me? And the monk basically says nothing and goes to get a cup of tea, tea in the teapot and the tea ceremony, and pours the tea, but just keeps pouring it. And the tea just spills over the edge. And then the guy goes, what are you doing? This is crazy. I've spent a month trying to come and see you and you need to tell me this stuff. And he said, look, what I know is that while the cup is still full, there's no room for anything else.
Yes.
You need to stop and listen. And I think it's such a great reminder, despite which I'm going to be talking, I think, with you for the next hour. But, after that, I'll listen.
Well, I think that there is something in that myth that you've shared that we can all take on into our daily life. Now, let's move back to the task at hand. And I want to understand what triggered this intervention study that you're talking about. And I want to make the point very clearly that this is within the Australian Human Rights Commission. So in my world, this is a very rare example, where government, the Commission, has recognised, and the funding opportunities. So perhaps if you can just give us a little bit of a scenario as to how this happened.
I will. It'll take a couple of minutes, put a couple of pieces together for you. But before this research in 2020 and 2021, partly as a lockdown activity because we couldn't go on the road for obvious reasons, we in the age team that I was then the director of did a really large piece of research that looked at ageism across the whole lifespan. I wanted to include ageism against and by younger people, middle-aged people, older people, all the generations. And when we got the results from that, one of the key findings really struck us, and that was the finding about how Australians see older people. And basically the headline is that Australians see older people as really nice. They were the warmest group in our study, people said, but frail and basically onlookers to life. And that really struck us, that we love Nana and Pop, but we really only love them if they're sitting on the sidelines somewhere, slowly fading away, maybe caring for grandchildren or baking cookies, but they're not engaged in any meaningful life roles or work in the community. And we felt that that had such implications for older people. If they don't have any meaningful activity or connection with the community, it's going to play out in workplaces, in shops, in the health system. And when you think that our participants in that study told us that they thought anyone over 63 was an older person, that's an extraordinary thing. So we wanted to do something with that. So we got some funding from the Federal Department of Health in Australia to look at a particular population of workers who work with older people. And we looked at people who worked in residential aged care, who did aged care in the home, which is a really big focus in Australia for older people, and people who worked in community settings, delivering meals, volunteering, running library programs, that kind of thing. So I can keep talking about that, or Jane, you can ask me another question first, but that's how we got to do that study.
Yeah, I think it's interesting that there were these three groups and the funding, because quite often, there is a disconnect in our world around health and healthy aging. Decade of healthy aging, we are trying to think about, the functional ability of an older person, because that, in some respects, really dictates where somebody is living. So these three groups that you looked at, aging at home, which means services going into the home, residential facilities, and in some countries that's called nursing homes. And then you've got this other community-based workers where perhaps independent older people could be. So I think it's interesting, those three groups. What also strikes me is this notion of who an older person is, that they're nice. So if we're crabby, well, then that kind of, explodes the myth, doesn't it? And if we have an opinion, that kind of explodes the myth, because in the main, being older and being an onlooker also equals some invisibility, doesn't it?
Totally. And I think that was one of our concerns, was that where's the agency here? Where's the choice for older people? And we also know that internalized ageism is a huge problem. All of you on the call will know this, of course. And if that's how you're being treated, and that's how because the people in the first study included older people themselves telling us that, as well as younger people telling us that about older people. So we wanted to look at the attitudes of the people who work with them, because that impacts older people's lives. And we know that from other research, that if you're in a health setting, the attitudes of the people around you has a really big impact on how you see your own capacity and possibility and health outcomes. So we did this particular study with the intervention to find out what's going on.
What you've just described is an absolutely terrific example of the WHO report, where you've got the person and the environment, and it's the interrelationship between the person and the environment that gives rise to healthy aging and the degree of functional ability. So I think that's really captured. Tell me, how many respondents were there? How many people?
We started off with 347, and by the time, so what we did was we administered a survey about their ageist attitudes. We didn't call it that necessarily to them, but that's what we were looking at. I ran a workshop. I ran 20 workshops in 20 days last November, 2.5-hour workshop with the intervention, and I can talk about what we covered if that's interesting later. We then surveyed them on their attitudes straight after the workshop and 3 months later.
Right.
And so it was quite interesting to see where they started. We found that our participants, so by the time they were doing the workshop, there were about 280 of them. And they came up before the workshop as slightly less ageist than the general population. We chose 3 really well-known scales so we could compare it to the general population more easily. And we think that was because of their exposure to older people. And I thought that was an encouraging thing, because we know that potentially contact with older people reduces ageism, and it seemed like some of that was going on. But after the workshop, those attitudes had dropped dramatically again.
So did you see any difference in the different groups? Because I'm thinking about healthcare professionals in residential settings versus community settings, because I think one of the great challenges of frontline workers during the pandemic was burnout and the increasing levels of dependency. So did you see anything there?
We thought we might, and we did a lot of regressive analysis and other analysis with an external research partner, and we didn't find a lot of difference in the different occupations. And partly I think that's because in Australia, at least, there's quite a lot of crossover of workers between working in nursing homes or residential care and delivering aged care in the home, coming in and out of what in Australia we call Meals on Wheels, food delivery services to people in the home, working as volunteers at the council, and all of them were exposed to older people. So we had this whole expectation there'd be whole chunks of the report about those differences, and they just sort of weren't there. So that was that finding. What we did find was that people of CALD background, culturally and linguistically diverse backgrounds, were somewhat more ageist, and particularly in areas of strong benevolent ageism, like feeling that older people need to be helped all the time, or that older people need to be protected from the harsh realities of life. And we thought that was quite interesting. And people from those backgrounds were also less positive about their own future, their own aging, which was something else we looked at in the surveys. So that was actually the major difference between the 3 populations. We didn't find huge differences between ages of workers, although older workers who were working with older people, so if you're in your 60s and working in a nursing home, had a double effect in a sense, because they had a really positive effect from the workshop on their own aging and their own sense of their own possibility. Because if you're working with a population of frail, potentially much higher rates of dementia, that kind of thing, it can cause quite a lot of pessimism about your own future, that everyone gets dementia or everybody declines quite rapidly, you know? And so that was quite positive. And it's not what we were particularly studying, but it was an interesting effect.
Yeah, look, it certainly is. I want to go back to CALLED, because, you know, if I think about the demographic upheavals globally, you know, we've got population aging is one of them, but certainly migration is as well. And so, you know, my guess is, although it's a guess, you know, cultural roots certainly play across the life course in terms of our belief system. So just because, you know, someone has been living in Australia for 20 or 30 years, the cultural roots are embedded in their beliefs. Would that resonate with you?
Totally. I mean, I know that as a general citizen in Australia, we have, you know, I don't know, 180 something nationalities, and I think 38% of our population at the moment was born overseas. So it's a lot. It's a big part of our culture. And we had a lot of people in the study who, because what happens, as you'll know, of course, is that if you migrate to another country, you generally, depending on circumstances, integrate quite well into mainstream society. But as you get older, you want to go back to the memories and the people and the culture. And I gather, you know, there are other intersections where that happens as well. So we had a number of groups, a number of workshops I ran for people who were, for example, Filipino, working in a Filipino nursing home with Filipino people, or Greek in Melbourne. We had a couple of, you know, Greek groups of people. And it was interesting talking to them, because a lot of them said, well, we don't actually have ageism. It doesn't exist in our culture. So our survey findings for us were particularly interesting after that. And when I drilled into it in workshops and in focus groups to some extent, they would say, well, we worship our older people. We dress them in their best clothes and put them on a big chair at family functions, and everyone comes up and pays respect to them. And in some workshops, the dialogue was open and permissive enough where I could sort of say, do you think, how is that for the person themselves in terms of their life? You know, particularly harking back to that finding about being onlookers to life, because I'm going to be 66 in a couple of months. And if someone put me in a frock on a chair and had all the family come up and worship me, I'd be horrified. I mean, I've got things to do and places to be. So that was kind of an interesting intersection. And I always say, you know, I'm now doing a follow-up phase where I'm trying to train the trainer and find more applications for the workshop. And I would love someone to do, because our funding has now run out, someone to do some work on that intersection of different backgrounds, aging, ageism, and workers. And you know, we made a small finding, but our study wasn't big enough to make any dramatic findings about that. But very interesting.
You know, the study had good numbers, so I think that's impressive. And for those that don't know, a frock in Australia is a dress. It's a dress.
Good dress. It's a party dress. A frock.
It's a party dress. That's right. Yeah, my staff, some of them are learning Australian. We do have a couple of questions, and I've got a lot more, of course. And I knew this question was going to come up. All right, Joanna, and I warned you ahead of time. So Dr. Cynthia Stewart is IFA's main representative of the United Nations. And Cynthia, go for it.
Well, it's really nice to meet you. And I do hope your book, at some point, the next edition will be beyond 60s and into your 70s and 80s. But having worked in Australia's Human Rights Commission, I just wondered if you had any insights as to why Australia will not yet support a convention on the human rights of older persons at the United Nations?
It's such a good question, and it's something we need to talk about a lot more. I have always strongly supported. I mean, I have a master's in international law. I totally want us to have a convention. I obviously can't speak for government officially, but what we know is that prior governments took a view that existing legislation and instruments were enough, that this was just embedded in different things. And what we also know is that that was rubbish. Like, it didn't work, it doesn't work. We've had a total sea change in our latest elections and government change, and we're all seeing really positive green shoots of possibility coming out of the new government. And same at the Commission, we're all firing up and pulling off our briefing papers and getting all excited about possibility. There are also many individuals and NGOs who are passionate and vocal advocates for a convention. So there's quite a lot of grassroots awareness raising going on. And I feel like I should apologise for what I believe is an appalling attitude. But I think there are signs of change. And so all I can say is watch this space, and please be assured there are many, many of us who are working very hard to try and make our commitment happen sooner rather than later.
And, you know, Cynthia, as we've always talked about, this is the long game. We would like it to be a shorter game, but this is about stickability. And you know, Joanna is quite right. Several years ago, you know, the then current Commissioner for Human Rights on Age Discrimination attended, you know, the UN open-ended working group. And, you know, politics change and people change, but I think we've put a stake in the sand to move forward. And I was very comforted to know that this study actually had roots in the Australian Human Rights Commission, because that says to me, very definitely something has changed. So we continue to support, you know, colleagues Opan, Andrew Byrne, Bill Mitchell, et al., that are really, you know, at the front line pushing forward. So thanks for your question. Joanna, I'd like to now ask Maya Abi Shahin to pose your question. Maya, are you with us?
Yes, hello. Good morning, everyone.
Hello.
So I'm the ageism consultant at HelpAge International, and I'm also a researcher, advocate for older people's rights. And I wanted to ask about the study. Did you find any gender differences in terms of the people you interviewed and in terms of the result, whether there's differences towards older men or older women with gendered ageism? And what, in your opinion, is really at the root cause of ageism? Because very often when we talk about ageism, people look at the surface, the tip of the iceberg, the laws, the attitude, the language, but this is the consequence of what lies beneath.
Okay, so a lot of fantastic questions. I love, like, what is at the root of ageism? It's a fabulous question. I'm not sure I'll be able to answer it entirely, but just to be clear, our study was intervention, which was a workshop that about 25 workers at a time attended a workshop for 2.5 hours, and we looked at age beliefs and attitudes. They had plenty of time to discuss them on table groups. I busted some myths about older people, about dementia rates, learning capacity, a whole lot of things. And so I wasn't so much interviewing them in depth in that. And then you asked a question about gender. I wasn't sure, is it gender of the workers or gender of the people that they're caring for?
Both. From that end and the other end.
Okay, so it's one of the areas, as I said, I was really hoping people will build on this and take it into more intersectional areas, and gender's, of course, the obvious first cab off the rank for that. The great majority, I'm trying to remember the exact stats, but let's say it was about 83% of our participants were women, because my experience is women tend to volunteer for these things a little bit more, and we have far more women than men as frontline workers in aged care, in personal care and things like that. We didn't ask or find out. We had some long ethical discussions about connecting these workers to a particular workplace and talking to the people they cared for. And in the end, because of time constraints, we didn't connect them. We interviewed other people in aged care as a separate thing, but the workers were the only ones we did. So I can't really make a comment on that. In terms of the roots of ageism, my total conscious intention with this project was to go upstream, if that's a framework you're familiar with, because I think it's super easy, and particularly in Human Rights Commission, to look at problems when they've been created downstream. And we spend a lot of time in our age team looking at elder abuse and the struggles of older workers to get work and things like that. I wanted to do one project where we went upstream before the people had presented as a problem to see how the attitudes inform what then turns into behaviours downstream. So we were mainly looking at attitudes, and you know, we had some amazing results in terms of the things we were looking at, which were things like 90% of people rethought the way they communicate with their older clients and patients. Nearly 90% had conversations with people about ageism. 86% changed actual behaviours in their workplace around the language they use with older people. Or I've got a little story I might tell right at the end to leave you with about changing what is offered to older people to engage with. And nearly 85% rethought their own attitudes to ageing. So we were delighted, but that was the scope of what we were looking at, was those kind of things. So our earlier report, What's Age Got to Do with It, the lifespan report, delved a lot more, but mainly from a desktop research point of view, into the potential causes of ageism. You know, we've done
Joanna, what's critical in this study is that it's one of those rare things called an intervention study. You know, there is not too many intervention studies in the literature. We can do a lot of describing, conceptualizing, but the intervention really is critical, and that's really pulled through in the work by the WHO. Now, before I come back to some of my questions, Shmuel Yerushalmi is always with us, Joanna. He comes every single week.
Wow.
I'm not sure whether, look, probably for the last couple of years, Shmuel. And so I have the honour of asking his question, and it's really about the role of education. You know, what is the role of education in destigmatizing, breaking myths? And perhaps you can touch on this train the trainer, because I think that's part, isn't it?
Yes, because if you're going to educate, you've got to reach lots of people. You can't.
Yeah.
You running 20 workshops in 20 days is not sustainable, fun though it was. Look, as you'll probably all know as well, we know that I love working in ageism because, unlike racism or sexism, ageism, while it's tolerated and prevalent, is potentially the easiest of the prejudices to start to dismantle and break down. And there's a body of research, and that wonderful 2021 World Health Organization Global Ageism Report has a lot of references on this. And at your conference in Bangkok, I had a real fangirl moment where I met the people that wrote that report, and I texted back to my team going, oh my God, I've met these amazing people, because it's a fantastic report. And we kind of know that the three things that are both the easiest and most effective in breaking down ageism are education, awareness, and that's what we were doing, positive images of older people, positive narratives, not made up, but not just dwelling on the decline and decay, the negative. Talk about the positives for older people. They're fabulous, you know. And we did that in the workshop as well. And the third one is intergenerational contact. So I think the role of education is critical, and that's why we picked that for our intervention. We thought that that was doable. We knew enough about it. We run a lot of training programs at the Commission, so it's something that was within possibility for us. And the results blew us out of the water. They were extraordinary. And I just think, ever since I did that migrant program in Lakemba in Sydney many years before, the power of good education, collaborative, fair education, to me is just enormous. So I don't know if that answered all. There was another question at the end, wasn't there, Jane?
No, that encapsulates it. I'm going to give you a question on notice, because I'm going to then ask John Peters to come forward. You know, this is a great intervention study. What's going to make it nationwide in Australia?
That was it, wasn't it? It was train the trainer and things, yeah. So because this study had such extraordinary results, we were funded to do some extra work for another 6 months, and I'm now overlapping that role with my accidental new role. So I've got someone to help me now doing it. So yes, we can run out lots more workshops, but still we're going to be a drop in the ocean. And so the main focus for me is encouraging people to read the report, get curious, come and talk to me. I'm really happy to share what we did to hopefully encourage people to run the workshops for themselves. Certainly at home, we're doing Train the Trainer. A lot of the workshops we ran were online, and we're running more online ones now. And fairly soon we're going to record 1 or 2 of them as a Train the Trainer aid. And then we're actively looking for people in councils, in HR departments, in large aged care organisations, all sorts of places to take on this. I'm also breaking down the content into a series of discussion guides, you know, where there might be a case study and some questions, or a video and some questions that people can use in their staff meetings, their team meetings, conversations you can have with older patients or residents about what they want to do, about putting it onto them, what they want, building their own capacity. So we have a whole lot of strategies, most of which are slightly in their infancy. So I'm happy to send a little update email in a few months as to how it went. We also have quite a lot of interest from America and Canada, and I'm still just trying to get my head around how easily adaptable the work is. I think it should be fine, but I'm always cautious about that. And look, if anyone wants to pay me to come to Canada or the States, I'm really happy to do that, but I think it's probably unlikely. It's quite a long way from here.
I'm not convinced about that at all. You know, the more that you talk, the more I think WHO needs to take a look at this. And for my colleagues, my staff online, Anna Sangster, Kira Cruz, and Emma Schmidt, I want you to think about this in the context of, you know, the global network of age-friendly cities, the Decade Partnership, the platform. So we'll come back to you, Joanna. Well, you know, if you don't try, you can't succeed. So, so John Peters, you've been waiting patiently, and come forward and ask Joanna your question.
The question I had was whether any research had been done in Australia among men sheds, because you said more women come forward with sharing their experience and whatever. And it's true, men don't volunteer such things, but there are over 1,000 men sheds in Australia, and many more around the world. We're getting things started here in Canada. And one of the things that we're finding in Canada is a kind of attitude in our society that older people are a drain on our finances and research and the healthcare system and so on. What we are trying to do with our men sheds is to put out the idea that we are not in fact a drain, but we're a kind of a bank of experience that society can draw on to move forward based on the best from the past. So I'm just wondering if any of that is happening in Australia as well.
Absolutely it is. And look, I could spend all day telling you all the other things we do in our team and other stakeholders I connect with are doing in this field. I mean, this research study in a sense is tiny, and to some extent it's a microcosm, but to some extent it's a little side bubble, and there's heaps of other things. Men's sheds are a huge movement in Australia. I don't know if it's exactly the same men's sheds as they have in Canada. And I've always thought they were an amazingly clever way of reaching men in an area that is easy and interesting for them. You know, we have a big focus at the moment on older men and things like loneliness and suicide. We know that, you know, women tend to, and these are vast generalizations, but I'm sure it's the same in most of your countries. Women tend to live multiple roles and multiple identities all through their lives. You know, they move in and out of work and caring, and they make friendship groups and join book clubs and, you know, all that kind of stuff, so that as they get older, they have the habit and the template for how to stay connected in the community. And certainly traditionally for many men, they would leave work and their whole social life was connected with work, or something would happen to their partner and the rest of their social life was through their wife or husband or whatever, you know, it was. And so I think men's sheds are vital, and there are other new things getting set up in Australia for like men's sheds and like blokes discussion. Blokes is what we call men, guys discussion groups that meet in pubs. That's always a popular way to attract people in Australia, meet in a pub, you know, in a bar. And I just think it's terrific work. You know, we know that the highest growth in suicides in Australia is men 75 and older. And wow, that's an issue. Lots of different people are looking at it in the health system and in the community sector as well. So,
okay, we'll need to move on. We've got a couple more questions. Yep. Thank you very much, John. Before I move on to our next question, I just want to acknowledge Prudence from Stockholm and Chandra from North Frontenac in Ontario. First time, welcome, come back again. And also Jenna Wicken said, you know, come to Canada, we want you here. All right. So I'm going to now, sorry, I'm just being, all right. So Christine Mulhorn, please, are you there so that you can come forward and ask your question? Very interesting, Christine. You there?
Hello, yes, hi. Thank you for asking me to talk. So yes, I teach aging in the US, and really interested in where, as you said, ageism starts early. And of course, we're talking about the workers, but I'm interested in what do you think the potential is for reaching young people? Is it in how early? and you know, is it in the schools, in the community, or both? Or I'm very interested in what you see as the potential.
I think the potential for that is massive, and it's where a lot of the work needs to happen, because they're the people who will become old. They don't know yes. that yet. We know that they will become old. And a couple of things. We had quite a number of younger workers on our focus groups. So we did focus groups for about 70 people, about a month or two after the workshops. And the younger workers were in some ways the most fired up, because it was really news to them. And there were some peripheral discussions about things like the advertising of face creams and stuff, you know, eternal youth and beauty and things. And several of our younger focus group participants were just evangelical about, oh, I'm not buying any more anti-aging products and this is rubbish. I'm going to tell all my friends. And, you know, so it's clearly a fertile market. And we asked our focus group participants who else they thought would benefit from this training, and it was kind of overwhelming. We had to put a section in the report to talk about it, because they said, oh, everybody, like kids in school should do it. Yes. A lot of the older women in our focus group said, and people who work in shops, dress shops, they have to do it because they never pay any attention to us. Everybody was united that doctors should do it. Lots and lots of groups, and part of my work now, I'm working with a First Nations group to try and adapt the workshop for their community. I would love to see it on the curriculum for people who are studying to go into different health avenues. I'm trying to adapt it also to deliver to older people themselves, because we know that internalized ageism, is a massive thing, and there's quite a lot of interest. I don't know, Jane, is the U3A in part of the world? So there's someone who's very connected in U3A in Australia who's quite keen for me to firstly to talk to their people, but also train them so that those people can go out and talk to community groups of older people and explain internalized ageism and all that sort of stuff. So potentially it's anyone and everything. And I think the more, we think of sexism and racism and how those campaigns started, it was awareness from the ground up. And the more people who become aware of ageism, a lot of people still don't know that it's a thing. I get people saying, I had no idea ageism was a thing. Is that a new word? So we got to tell everybody. You can tell I'm a bit passionate about this.
Well, thank you so much for that passion. I appreciate it. And I'm certainly motivated more after your talk. Thank you.
That's okay. And just in case it doesn't come up, I hope my email address, I think, is going into the chat. If anyone's interested in a Zoom call more about what we did in the workshop or how you could use it or anything, just please get in touch. I love talking to people about this. Sorry,
and we'd be happy to host another session that only focuses on that if it was useful. All right. So Jenna Wickens, we're rapidly running out of time. Jenna, you had a question for Joanna, very specific question, which I think is important. You there, Jenna?
Yeah, I'm here. Hi, Joanna. I do a bunch of ageism presentations, ageism awareness. My agency is one of the lead organizations in our area for doing those things. In 2 weeks, I have the opportunity to present at a conference for medical managers. And so in Canada, our healthcare is provided by the government. But my question for you is, if there was one thing that you could let doctors and other people in healthcare know about ageism, what would it be? Lots of research and various things that we're talking about. I have a brother who's a doctor who said things like, well, you're getting older, what do you expect? So just want to hear your thoughts on that.
Yeah, look, it's clearly, it's clearly a big area. I, through various means, was allowed to lurk in a Zoom group for oncologists, geriatric oncologists in Sydney, and they'd started this anti-ageism group of doctors, senior doctors who work with older patients who have cancer. And I was really excited because I thought, there were about 20 people, specialists, professors, all sorts of people on this thing, and they meet every couple of months. And it took about halfway through for me to realize that they had no sense that there was ageism amongst doctors. Doctors were fine. They met so that they could break down the ageism amongst their patients who they thought were resisting treatment because they felt they were old. And it just took me ages to get that paradigm into my head. And so there's a lot of work to be done, I think, with doctors. And I don't think I can think of the one quick magic bullet now, but if you want to give me your email address or we can have a chat, I'm happy to talk through things, but I don't have the one answer. But it's a conversation that I think has to be had in many ways and every possible, environment, to get doctors to even talk to the patient, not the patient's daughter or carer or, all that stuff. So I salute you. I think it's great work.
Oh, thanks for that, Jenna. And I note Jane Carmody, another wonderful colleague and friend and on the call today. The term ageism was coined by Professor Robert Butler, back in 1969. So raising awareness, we're looking into decades and decades. And I think what you've done today, Joanna, is you've actually taken a concept and you're actually looking to what can we do as interventions to change that. So, but there's one question that I need to ask you. Looked at your new title, Joanna, it reminds me of something like the FBI or the CSI. So you're now going to be, oh, you are, this is end of week 1, I think, or week 2, the Director of Human Rights Scrutiny. Is this a new sort of new title initiative for something?
No, it's actually Director of Human Rights and Scrutiny. The challenge we have is we have lots of commissioners, and then we have a Human Rights Commissioner, and we're all the Human Rights Commissioner. Everyone gets confused. So we're the people who, so in Australia, we have a number of separate acts: age discrimination, race discrimination, children's rights, First Nations rights, disability, and then we have this overarching human rights. And the scrutiny really started because we were scrutinising legislation to see whether it complied with human rights, but it sort of has stuck as a cute little name. But basically it's nationwide issues like refugees, the growth of AI, that's a massive thing for my new team, human rights impacts of artificial intelligence, modern slavery has been a real focus of ours for the last 5 or 6 years at least, children's rights, a whole lot of things.
So we'll ask you back in 12 months to actually tell us about your job as the Director of Human Rights and Scrutiny. As we come up to the hour, Mark Benning, and thank you, Mark, you were very kind in being one of the people that we're able to interview for our focus group on immunisation. You made an important comment in the chat box, and I'd like you to pose it as a question to Joanna. Could you just restate it?
Yes, excuse me. I had an 82-year-old friend of mine who was at a doctor's appointment, and her doctor, she had some issues health-wise, I guess. But the doctor said, well, you are 82, you're on the bonus round now, so sit back, you know. Can you imagine the reaction she had, the look on her face at that point? So if doctors are thinking like that, imagine how everybody else is feeling, right?
Yeah, and I think I know in Australia, one of the issues is that when people are training to be doctors, by definition, they're almost all quite young, and almost none of them are interested in studying geriatrics or gerontology. You know, they want to go into other fields. We have a related problem at the Commission. No one ever wants to intern in the age team. They want to go and intern in race or sex team or, you know, whatever. It's a similar thing. It's not cool. It's not whatever. And so we have a vast shortage of geriatric specialists and gerontologists. And I think I've read a wonderful book, can't remember the title right now, it's getting quite late here, but about the system, certainly in the States, same problem. And if you don't have a lot of people who are experienced in geriatric medicine, it's really easy. You know, if you're a general practitioner in Australia or even a cancer surgeon, you've probably spent, what, an hour in your training talking about old people, really. And so you just assume, because you look around you, you just assume that you're lucky to be alive at 82. And, you know, people, there's a vast underdiagnosis of, well, there's an overdiagnosis of things like depression in older people because they assume all older people should be depressed, so they don't look for the real medical cause that's underlying sleep problems or whatever it is. There's a huge amount of work to be done in age, you know, age and medicine.
Yeah, and you know, for those that, well, we're all growing older, but don't be onlookers, you know. Let's not be that population of onlookers. So, Joanna, I'm going to pause you there for a moment and introduce the topic for next week. Thank you, Ashni. You know, it will be a great pleasure to be in conversation with Dr. Habib Chowdhury. Dr. Chowdhury is the Chair and Professor, Department of Gerontology at Simon Fraser University. And we'll be in conversation and having coffee with him about designing dementia, inclusive spaces in long-term care settings. I, for one, will be fascinated to hear, his thoughts about this, considering the state of play of long-term care in Canada. So I think that I will be a vocal but thoughtful critic and person who asks questions. So join with us. We are, as you can hear today with Joanna Maxwell, just leading experts that are shining lights on emerging areas that we need to pay attention to and be active participants in change. So thank you, Ashley. As we turn back to Joanna for her closing remarks, thank you for your patience today. I'm using an iPad, so I don't know where I'm looking. So if I'm looking away, you'll know that I'm looking at the wrong camera. To my colleagues back in Toronto, particularly Ashley and Roxana, thank you for being that backup plan B. And most of all, Joanna, I knew this would be a fantastic conversation between you and me. Some Australians, you just kind of think that you're their best friend, even if you don't even know them. And you're that kind of person on a Friday night. So thank you for being with us. I'm so impressed with the work that has been done and will be done, in this particular area. And so I give you the floor to close this Global Cafe for today, and then you can go and put your jammies on and hop into bed.
Oh, too exciting. Find my teddy. What I want to finish with is really a little story from one of our focus groups, and it illustrates our belief at the beginning of this study and our conviction by the end, which is that ageism may be the most pervasive and socially tolerated of the prejudices, but it is the easiest to begin to dismantle. Many people, most of us, me, have unconscious and often well-meant ageist beliefs, benevolent ageism about helping older people. In our first study, the form of discrimination that older people themselves were most bugged by was being helped without being asked. And we all think it's useful to help older people, and often it's useful to help anybody who needs help, but it's good to ask. And awareness is a huge step. So I want to finish with a story that a librarian called Kim told us in a focus group. So before the workshops, Kim was in charge at her library of programs for older people. And a guy approached her and said, I want to run a robotics class for older people. And Kim was honest enough to tell us that at that time, she said to him, don't be ridiculous. Older people aren't capable of learning robotics and they wouldn't be interested in it. Go away. So he did. She did the workshop, and we talk a lot about capacity and, rethinking assumptions and stuff. So she decided that her homework would be to go back and find that person and say, okay, we'll give it a go. So the guy came back, he ran a robotics class at the library, 15 people oversubscribed, they had a waiting list, 15 people did the robotics class. They said it was amazing. The evaluation was extraordinary. One woman wrote in big letters on the back of her form, this is the most fun I've had in a library ever. And it was so popular that it's now run quarterly and it's always oversubscribed. And it's a little thing, but what an easy thing to shift, just from a 2.5-hour workshop or a light bulb moment. We can start dismantling this one robotics class at a time, I think. So I'm happy to end there, but thank you for all those great questions. And the woman who wanted to know about doctors, please do get in touch. I hope you'll send me maybe the chat or something so I can get in touch with people.
But what we'll do is we'll package all of these questions up, because this has been a really fun, informative and inspiring session. And I think that your story says it all. One of the key messages out of that story is that person said, I made a mistake, I'm going to go back and see. And it's that pause, and reflection on ourselves. So
Absolutely.
Thank you so much. When I'm in Australia, I'm going to catch up for a coffee, Joanna. All right. Okay. Be
or
well,
wine.
everyone. Wine, good, yeah. Stay safe, stay well, and we look forward to being with one another together next Friday. All the best. Bye.